Thank you for joining us. My name is Nancy Miller and I'm the Director of Education and Research here at the Vitality Institute, the makers of the original VI Peel. And today we're going to go through the application of the VI Peel Purify. We'll discuss how do you select the appropriate patient, how do you apply the peel, and how do you talk to your patient about the aftercare. The VI Peel Purify creates a unique blend of acids. In the Purify, you're going to absolutely have those core 5 ingredients: TCA, retinoic, salicylic, phenol, and vitamin C. But we're adding in additional ingredients focused on treating oil production, suppressing sebum production, and reducing acne breakouts. In Purify, you're going to receive those 5 core ingredients, but in addition, you're going to notice there's benzoyl peroxide, hydrocortisone, and kojic acid in the blend. With Purify, your target patient is going to have slightly oilier skin, greater sebum production. You're probably going to note their skin is a little bit thicker than your normal to dry patient, right? Ethnicity-wise, you're going to look for patients who have Hispanic descent, Middle Eastern descent. These are your typical patients who would be most benefited by receiving the VI Peel Purify. In your VI Peel Purify kit, we're going to go through the components. You will see a larger baggie which contains a patient aftercare kit. Once we finish Julia's peel, we're going to review all of the components within this aftercare kit. In addition, you will receive 1 VI Peel Prep Towelette, 1 applicator cup, 1 VI Peel Purify vial, and a 2x2 woven gauze to apply with. So Julia is joining us today for a VI Peel Purify, and Julia is experiencing a little uniqueness in her skin right now. She's having a combination of increased oil production, but she's also having some breakouts, due in part to a little bit of hormonal change, but also some environmental change. So she's got a little bit of erythema here. Generally speaking, Julia tends to be a little bit oily prone, and she gets occasional breakouts. And right now for her, the breakouts are slightly increasing. All of the VI Peels are safe for 13 and over. And when we talk about Purify, is really when you're going to start using or really looking at the age range of patients. So Julia's skin is cleansed, and we're going to proceed with the first step, which is applying the VI Peel Prep Towelette. Now the Prep Towelette is acetone-based, 100% acetone. When you open the towelette, just make sure that you keep it upright because this towelette is overfilled. There is a little extra acetone in here and you will find it very useful. So just make sure you open it away from your patient's face and keep it upright. When you open the towelette, I personally like to fold mine in half. I feel that I have better control over the towelette. So as we come over to Julia, we are going to focus on degreasing her skin. Now, degreasing the skin means we are removing the surface oils that naturally exist on our skin surface. Surface oils are amazing, but not right before we perform a chemical peel. Surface oils are a barrier to the peels penetrating to the desired depth. As we degrease our patient's skin, we are removing those oils to improve the overall penetration of the VI Peel into her skin. So we're going to go ahead and resaturate with the little bit of acetone that's in here. And we're going to continue degreasing her skin until we see a nice matte hue. We don't want any sheen to the skin. I'm going to have you roll your lips for me, Julia. Thank you. And relax. Acetone is probably the best solution to degrease because not only is it effective at removing the surface oils, it will also begin to dehydrate some of the cells, which will further improve the depth of penetration of your peel. So we've completely degreased Julia's skin, and you will see a nice matte hue to her face. At this point, we're going to go ahead and open our VI Peel Purify vial. You're going to remove the flip top cap, lift the little cap there, apply counter pressure with your non-dominant hand, lift the pull tab, roll it down, and remove the collar. All the time applying counter pressure to the rubber stopper. Away from your patient's face, you're going to go ahead and release that. Pour the peel into the applicator cup, and you're ready to proceed to application. To apply the VI Peel, you're going to use the 2x2 gauze included in your Purify kit. Remove the gauze from its surrounding. You're going to fold the gauze in half, place it between your index finger and your thumb, and control the gauze. You can also fold it into fourths before you proceed. For comfort, I prefer this method. Once your gauze is prepared, you're going to go ahead and dip it into your applicator cup. The product will wick up the gauze, and your goal is not to have a dripping solution. You want your gauze saturated but not dripping. So just apply some pressure to the outside of the applicator cup, and you will have a saturated gauze that is ready to be applied. And now we're ready to apply the VI Peel Purify to Julia. When we apply the VI Peel Purify, we're going to start with the most resilient areas of the face and move to the more sensitive areas. So we're going to begin on our forehead, and we're going to apply with a medium pressure, even application. We're going to sweep the entire forehead, proceed down the temple to the right cheek. You can overlap these layers about 20 to 30%. We're in control of the gauze. And now that we've done the perimeter of the face, our gauze is a little bit less saturated, and we're going to move on to the medial area of the face. We're going to sweep down the nose. I'm going to ask Julia to roll her lips for me. We're going to do her upper lip and her chin. And relax. So after our first pass, we're going to pause, and we're going to do 3 actions right now. We're going to assess the patient's skin response. We're going to assess the patient's pain level, and we're also going to assure that our solution has penetrated. So Julia, can I ask you, on a pain scale of 1 to 10, with 1 being very little pain and 10 being the most pain, where would you say you're at right now?
Not like a 2, 1
2?
or 2.
1 or 2?
Yeah.
Perfect. And so her skin has flushed just a little bit. The product has penetrated quite well. And we're going to do this assessment between every layer. We've completed 1 layer, we've assessed our skin, and we're ready to proceed with the second layer. So we're going to go ahead and resaturate our gauze. Again, saturated but not dripping. This time what we're going to do is we're going to apply a little bit more pressure with application. So we're going to apply with a medium to a medium firm pressure. We're going to apply in a similar pattern, and we're going to complete this pass with her nose. And have you roll your lips one more time. Upper lip and chin. Perfect. So the second pass is complete. Again, we're going to allow 30 to 60 seconds. During that time, we're going to assess her pain level, her skin tolerance, as well as product penetration. So Julia, can I ask your pain level on this pass?
I'd say this is more like a 3.
A 3?
Yeah.
Okay, great. And still tolerable though?
Yes.
Perfect. And it's very natural to have a slight pain lift right after application. And if I wait about 30 seconds to a minute and I ask her pain level again, you're going to see that it's going to bottom out right back to a 0. So if I were to ask you again, pain level, has it started to taper down, or is it still high?
Yeah, it's at a 0 now.
It's at a 0 now. Yep. So it's very predictable. Okay, so pass 2 is complete. Her skin tolerated well. Her pain level is normal. So we're going to go ahead and resaturate our gauze and move on to our third pass. With this pass, you can approach more as a crosshatch technique, so you can apply from the eyebrow to the forehead with more of a medium to medium firm pressure. You can also follow along the hairline and proceed in a more vertical fashion of application. And as your gauze is a little bit less saturated, you can proceed down the nose, upper lip, and chin. Julia, how's your pain level on this one?
Like 2.
2? Perfect. Great. Her skin, again, is responding quite well. And the last thing we're going to look at is product penetration. So we do see a little bit of product just kind of sitting on the surface on her forehead. And there's a couple reasons for that. The first can be possibly I didn't apply enough pressure when I was doing that pass. It could be that I may have been too saturated in my gauze, or possibly I did not degrease her well. So those are the 3 culprits of products sitting on the surface of the skin. But there is an easy remedy. Before you proceed to your next pass, go ahead and use that gauze and apply a little bit more pressure, and you'll see the product penetrate really quickly. So you can just eyeball, take a look at the full area of her skin. So any areas that you feel perhaps have not penetrated fully, just give another swipe in a crosshatch pattern and you'll get the product to penetrate. Great, so our third pass is complete. We're going to go ahead and resaturate and move on to our fourth pass, which will probably be our last pass, but we'll see how Julia does. Again, we want the gauze saturated but not dripping. Got a little extra solution here. Okay, so we're going to start on your forehead again. I'm going to sweep her forehead, medium to medium firm pressure. Cheek outward. Switch hands, come on up the left cheek. Okay, and at this point we can go down the bridge of her nose, sides of her nose. Ask her to go ahead and roll her lips. Perfect. And complete the application here. So with Purify, because of the benzoyl peroxide, you might have to, as you're seeing here, complete that one extra, almost re-glide over the skin. It's not another layer because we didn't resaturate our gauze, but we're just going to help the product really penetrate into the dermis. So just a little extra help it might need. Again, if you think about your patient profile for Purify, these are your patients who have slightly oilier skin, thicker skin. So we're going to have to help those acids with our pressure and our technique penetrate to their fullest. Perfect. So that was your fourth pass. How does that feel?
Same, like 3.
3? Perfect. Great. And as you can tell, again, still a little bit of flushing in the skin, which is 100% wonderful. But her response is within normal limits. Her pain level is within normal limits. We've gotten that product to completely penetrate. She's got a nice flush to her skin. So there's just a little bit of product left. And remember, our goal is to use that full dose. So again, we're going to start on the forehead. This time I'm going to do a vertical sweep. And we're going to come down to her left side, again, vertical. Still maintaining that medium to medium firm pressure. The right side. Her chin. Okay, have you roll your lips for me one more time? Beautiful. So if you get a little bit of streaking, again, it's all repairable. Just add that little bit of extra pressure. One more pass in a crosshatch pattern, and you'll be all set. Okay. So we've completed the VI Peel Purify application for Julia. Couple things I will point out as a little tip. For your patients who are a little bit more fair in skin tone, they may see a little bit of a line of where you have applied the peel versus where you haven't. So if you'd like to blend this in for them, you can by using your ring and middle finger and just gently, a little bit of pressure and a rolling motion, you can blend this in where they will not notice any change in the coloration of their skin tone. Okay, perfect. We have just completed Julia's VI Peel Purify. So we're going to spend a few minutes discussing the aftercare that she's going to do at home. VI Peel Purify has a unique aftercare that is customized to the peel she received in office. The aftercare kit includes a very detailed patient information booklet which details every step of what they're going to do to care for their skin for the next 7 days. Now that we have completed the peel application, nothing will go on Julia's skin for the first 4 hours. No moisturizer, no sunscreen. At the 4-hour mark though, she is going to begin to implement post-peel towelettes into her home regimen. The post-peel towelettes are an extension of what you are doing in office. What they do is provide another designated dose of the acids in the VI Peel Purify formula that she will apply to her skin to continue to rejuvenate and stimulate her skin. The post-peel towelettes need to be completed in the first 48 hours after the VI Purify application. At the 4-hour mark, Julia will go home. She will do a cool water cleanse with a little bit of our gentle purifying cleanser. She's going to use her fingertips, cleanse her skin, pat dry, and at that point she is going to apply the first VI Purify towelette. Now the VI Purify towelette is bringing all those great ingredients of what you just performed in office. You're getting retinoic acid, benzoyl peroxide, hydrocortisone, kojic acid, all being brought back into this towelette that she will apply another dose at home. After she's applied her first towelette, she's going to wash her hands, wait 10 minutes, and for darker Fitzpatrick's 4, 5, or 6, they're going to apply our post-treatment repair cream everywhere that the peel and the towelette was applied. The post-treatment repair cream is a 1% hydrocortisone with colloidal silver and oat kernel and aloe. It's a very healing product geared at not only hydrating the skin, soothing itching, but also preventing inflammation. After the first towelette is complete, Julia is going to repeat that same process 1 hour before bed tonight. She's going to take some cleanser, cool water cleanse, pat dry. She's going to apply her second Purify towelette to every area that the Purify was applied, avoiding her lips and her eyes. And after 10 minutes, she's going to apply just a touch of the post-treatment repair cream. Tomorrow morning, she's going to wake up, she's going to cleanse her skin, she's going to apply a little bit of the post-treatment repair and our SPF 50. And I will always have Julia carry these with her in her handbag so that should she ever need a little moisturization or need to reapply the sunscreen, they are with her and she can continue to reapply them throughout the day. Tomorrow night, she has 1 more round of towelettes. Cool water cleanse and pat dry. Apply the VI Peel Purify towelette everywhere that the peel was applied. Discard it and wash your hands. After 10 minutes for darker Fitzpatrick's 4, 5, and 6, they will apply a light layer of the post-treatment repair cream. Using the post-treatment repair cream will help with itchiness and dryness. And most patients can use this very sparingly, just as needed, right? So if they have a slight bit of dryness or itchiness, just a very light layer is needed. If this is overused, it will mask the visible peeling process, and so patients may experience just a more form of a light flake versus the peel. So the patient aftercare with VI Peel Purify is included step by step in this booklet. But to further assist you and further assist the patient, we have developed the only aftercare app for any chemical peel, the VI app. And this will walk your patient exactly through the steps that they need to take care of their skin and ensure their best results. This app was developed as the company was developed by a practitioner for practitioners. And so what you're going to note in this app are several features that will help you as well in the field. There is an FAQ section that will answer the most commonly sought after questions by patients. There are push reminders. So if a patient forgets a step, it will automatically push them a reminder. So those forgotten steps and those late night phone calls to you will significantly be reduced with the support of the app.